was my privilege to be the moderator for this year's MEDy Awards. We had a number of companies who were applying to vie for 4 distinguished awards. And what those companies had to do was to present a 6-minute pitch. 4 minutes would be a formal presentation, and then 2 minutes would be a question and answer by our distinguished judges, who I'd like to invite on the stage now to present those awards to the winners. We have Paul Grand, Stephanie Morris, Mar Perez, and in absentia, we have Andrew Farquharson, who had to leave early tonight. There we are. And on our right, we have Stephanie and Paul, and then Mar. So I'd like to bring out our first award. And what we're going to do is have each judge describe what that award was and make the presentation to the winner, and we'll do that 4 times.
Well, I'll be the first one. So the best pitch goes to Adam Odesky, Sensley. And the reason why we decided to give him the award is because he was able, in only 4 minutes, to explain and to address the key points that we need to know to judge a company. So he talked about the market, he talked about the business plan, he talked about the revenues, and he did it in a very clear and simple way.
You're now going to get the presentation that we saw. It was 4 minutes. And
congratulations.
Maybe it's fully booked.
So my name is Adam Odesky. I'm the co-founder and CEO of Sensley. We're a virtual nurse platform that helps physicians better manage their chronically ill patients. In addition to myself, we built a team of doctors, engineers, and startup ninjas. My co-founder is a doctor and PhD in clinical psychology. We have a core engineering team from the University of Illinois Urbana-Champaign, and we have voice user experience designers from Nuance. So what is the problem that we're trying to solve? We all know the disproportional share of costs that chronic diseases pose on our country. Over 100 million Americans are affected, and doctors and budgets are struggling to cope. The problem has reached crisis proportion. And we think that technology can really help, but not just any technology. We need patient engagement, we need actionable data, and we need to create value for all stakeholders in the ecosystem, including payers, providers, and patients. And that's essentially why we built Sensley. Sensley's unique user interface was purpose-built for deep patient engagement. It is mobile-first. It combines our virtual nurse avatar, Molly, with artificial intelligence, speech recognition, medical device integration, and telemedicine. We make patient interaction simple, intuitive, and motivational, and we've proven it to be highly effective because of the power of the virtual human connection. Here's a video of how it works.
Time for your daily check-in. How are you feeling today?
Pretty good today.
Good to hear it. I see you slept 7 hours last night, which is more than usual. Good job. Let's check your weight. Please step on the scale and remain on until I tell you your weight. Your weight is 125. You gained a few pounds from yesterday. I notice you did not take your regular walk yesterday. Do you think you will have time for a walk today? What did you have for breakfast?
An omelet and some coffee.
Great. You had some protein. I will check in later to see what you had for lunch. Because of your weight gain and the risks it may cause, I would like you to speak to the nurse. I will have the nurse contact you later this afternoon. I will talk to you soon.
But that's not all the product does. Inside Sensley, we built an intelligent workflow that puts the clinician in the front and center of the product. So using this workflow engine, the clinician can easily assign new programs and content to the patient, monitor the patient, stratify patients for risk, and get alerted if the patients experience any unusual risks, such as ability to go to the hospital. At the core of our product is an artificial intelligence engine for clinical purposes. To build this engine, we crowdsourced chronic disease content from all around the world from medical experts. We're also collecting lots of data, including verbal data, behavioral data, and other kinds of data. And we're using machine learning techniques to personalize the engagement with the patient using this data and make the engagement even more human and more interactive. As with every chronic disease program, we also monitor basic behavioral things such as sleep, such as diet, and psychosocial issues. So in addition to maintaining the patient's chronic condition, we want the patients to lead a healthy lifestyle as well. So we sell to hospitals and insurance companies on a per patient per month level. Our customers today include some of the biggest names in the industry, and being only a company that's 2 years old, we're very fortunate to have these customers. We have both pilots and commercial deployments, and some of the data that we've already collected from our pilots include a 90+% enrollment rate, 24% call reduction, and 9% promoter score. So thank you very much. We're Sensley.
Thank you.
Great. All right, so our next company that we picked was in the one to watch category. And the one to watch category was supposed to be celebrating a company for whom it might still be early, but we think is celebrating, has a tremendous opportunity, a big creative idea. And the company we picked in that category was Beyond Verbal, with Yuval Moore, CEO, so come on out. And we really liked that he had, we thought, huge potential to impact patient care, nothing to manufacture. I don't want to steal his presentation, so I'll let him give that, but congratulations. There you go.
Thank you. So I'll let you hold on to this. So my name is Yuval Moore, and I'm one of the co-founders and CEO of Beyond Verbal Communication. I'm here to tell you that our heart has a story to tell, and for the first time, I can tell you that there is a room for us to listen to the story that our heart is telling. What we are doing at Beyond Verbal is we are transforming voice analytics, voice signals into measurable biomarkers, and our initial research shows that some conditions of our hearts can be correlated with specific voice features. The reason using voice as biomarker is so exciting is because collecting voice can be very cost-effective and can be done in a passive, in a continuous way. The technology that Beyond Verbal is using has been in development for over 21 years, leading to what we call emotions analytics engine that can decipher and decode humans' emotions just by analyzing tone of voice. It's currently in deployment in a few commercial applications like call center and market research, as well as applications that are being deployed in machines, helping machines having better communication with us as humans and more on an emotional level. But what we've learned with recent research in the last few years is that the voice cannot just carry information about our emotions, it actually carries information also about our health. It can give some health indications. We have done work and identified specific acoustic features with areas such as autism and Parkinson, and we keep enlarging and doing more research in other areas using new partners. One of these partners that I want to focus on today is the work that we've been doing with Mayo Clinic. So we've done a research pilot study with Mayo Clinic using smartphones. In this research, what we are doing is correlating or trying to correlate specific voice abnormalities with situations like coronary heart disease or CAD in patients that were referred to elective cardioangiography. What you can see here on the left side is a diagram of a patient, specific patient that was recorded before catheterization and after catheterization in the follow-up after 1 and 2 months, and you can see really the big differences there. And on the right-hand side, you can see how with just 2 acoustic features, we are able to separate between CAD and non-CAD patients. Of course, in the lab, we are using many more features, and the more information we can get to very high separation. But even at this initial stage, we can see how this can be used and really revolutionize the whole process, because this is something that was never done before. being able to correlate between voice features and congestive heart failures. This ties into the whole revolution of using wearables and using mobile devices. But this is something that other companies, of course, are starting to pay a lot of attention to. This is the example from Apple launch of the research kit when they talked about being able to detect Parkinson with, I'm finishing in 10 seconds. Also, the recent head of mental health at Google that talks about the ability to just monitoring voice and getting a lot of parameters. We envision a world where voice, as well as other parameters, are being used to detect, help us continuously monitoring our health and wellness, and we are just very proud to be part or actually leading this revolution. So thanks for the award and thanks for the opportunity.
Thank you, Eyal. Thank you very much.
Thank you.
Very good.
Good job. Nice to take the award.
Mine.
Yeah.
Thanks.
Excellent. Okay, great. So next category we have for you is the Convergence Award. And this was for a company that was operating in a space where they're converging two areas of technology. So examples were robotics or artificial intelligence. And again, I want to steal the show for this presenter. But the winner of the Convergence Award for this year is X2AI. That's Michael Rouse. So come on out. Congratulations. Your MEDy award. Oh, we got to shake hands.
Yeah.
Congratulations.
Thank you.
There you go. Very good.
There you go. Hi, I'm Michael, CEO of X2AI. And today, I'm going to tell you a real-life story. 1 in 4 people are affected by some form of mental illness every year, somewhere throughout their lives. Now, in this room, there will probably be around 200 people. Well, don't worry, I'm one of them. The main reason people don't seek treatment is treatment costs. The CDC has estimated that yearly there's an annual productivity loss of over 30 billion by depression alone. Enough reason for Obama to pass the Affordable Care Act, to give people access to small budgets to seek help. Now we get to the next bottleneck. The mental health care system is simply not ready for this increase in demand. This is the problem we're solving. Ideally, you'd have a solution which is there 24/7 for the patient. Therefore, this solution should be scalable. But it shouldn't become impersonal, so it needs to be emotional as well. And it should be self-learning, to really adapt to every person's personal life story. Only in this way we will get to a truly patient-centered solution. However, this is a really heavy load to carry for the therapist alone. That's why there's Tess to help them out. She is our emotional artificial intelligence who holds conversations with the patient. She will be there for the patient, and really, she's there where the patients are people, like you and me, just texting with friends and family and keeping in touch with their loved ones. Now, this all seems like a wonderful dream, but I promise you a real-life story. We're in the market right now. For a large mental health clinic, we're supporting patients who suffer from minor depression and are taking internet-based therapy. We started off with 100 patients, but soon enough they asked us if we could ramp this up to 5,000 patients. Our next pilot will be with Radboud UMC. There, we will be helping patients with diabetes to lift their psychological barriers to therapy adherence. Their therapists are so excited that they even work with us to improve the system even more. This pilot will start beginning next year. So what's the unique magic behind this? How is this all possible? We did over 8 years of research into psychology and machine learning to create emotion algorithms. These algorithms sense how someone is feeling and determine how to respond accordingly so that we really start creating an emotional bond. Secondly, our talk therapy engine determines the content of these conversations. It's based on cognitive behavioral therapy, which has been empirically proven time after time again to be effective in treating mental illness. Who are behind X2AI? I'm Michael, the CEO and doing business development. Eugene Ban is our CTO. Then our board of advisors. Let me tell you about Lucien Engelen. He always makes sure that we are directly in touch with the patients at his hospital to truly stay a patient-centered solution. Last but not least, Derek and Rebecca, our psychologists. So I want to leave you with one final thought. TESS saves lives. In the future, we will be able to help people to prevent them from taking their own lives. Today, we're helping them fight mental illness so that they can truly start living their lives today. Thank you.
Thank you. Thank you. Okay.
Well, I have the last category, one that's really exciting, which is disruptive breakthrough technology. And I would like to bring out Universal DX, Juan Martinez Barea, the CEO, and Marco Bittenk, CTO. So congratulations. Just to tell you quickly about this company started at Singularity University in 2012. They were incorporated in Spain, so this is a global company. They are now in the Valley, Silicon Valley that is, and they have a universal cancer test, which is going to be one drop of blood to diagnose very early stage cancers. If any of you have ever had a colonoscopy, you really want this technology to come to market. Please.
Okay, thank you. Good evening to everybody. My name is Juan. First of all, I would like to thank Daniel Kraft for all his help with our company and for inviting us to attend this conference, and to the jury for selecting our company. Well, our company, what problem are we trying to, or are we aiming to solve? 40% of humanity will develop cancer during their lifetime. This is huge, 40% of us. And the problem is that we don't know who will develop it, we don't know when we will develop it, and we don't know where in our body. So this is a huge threat for all of us, and in fact it's like having a time bomb inside of us doing tick-tack, and we don't know what's going to happen. So what's the solution that we are trying to find for this? Is early detection, because when we detect cancer makes all the difference. Cancer kills because we usually detect cancer late. But 90% of cancer cases are curable if they are detected in stage 1. So we are working on that. We are developing blood tests for the early detection of cancer. We are working in the intersection between metabolomics and bioinformatics. Our hypothesis is that cancer changes our metabolism, even from the earliest stages of its development. Our body starts producing differentiated molecules that up to now we were not able to read, but now with the exponential development of the detection technologies, we are able to detect those molecules. In fact, we have been able to identify 52 unique and differentiated molecules that are the signal of cancer. And we have also developed a machine learning algorithm able to find intelligence out of those thousands of data. Okay, so we have already tested more than 4,000 patients, and we have developed a unique diagnostic system composed of 3 elements. The first one is a robot that takes the serum sample from the patient and prepares it to be analyzed. The second one is a sample analyzer that look for those 52 biomarkers and identify the concentration of each of them. And then the third element is our cloud system where we upload the raw data and we find a final diagnosis of the patient. Well, what is our final mission? Our mission is to develop a universal cancer test, a test in which you take only 1 drop of blood of your finger, put it here, close it, and send it to us, and we analyze 10 types of cancer with only 1 shot. and with more than 90% accuracy, and for $99. This is our goal. Why $99? Because we would like to make this test globally available all around the world. But we have to go step by step. And now we are producing the colorectal cancer test. We are now launching 2 studies with more than 4,000 patients in order to develop. In October 2016, we want to have the first product in the market, this test, able to detect not only colorectal cancer, but also polyps. In this way, we will be able not only to detect cancer, but also to prevent cancer. Our company was created 3 years ago by 2 alumni of the GSP program of Singularity University, Marco Bitteng and myself. And SU will have our gratitude forever, not only because we met there, but also because we found at SU the inspiration to attack one of the biggest problems in the world. We have now a team of 20, 2 headquarters, R&D in Spain, business development in Silicon Valley. Well, this is our company. Our vision is to make cancer a curable disease. And we really believe that we can make it possible. Thank you for your attention.